Welcome back. You're watching NewsX. My name is Vineet. Malhotra. As China fails to control its COVID surge and cries that it is impossible to track the number of cases, India raises alarm and has acted eagerly and early on it. India has ensured a successful vaccination drive. Does China's vaccine failure now pose a risk to India in the form of new mutations? Union Health Minister Mansukh Mandaviya chairs a high-level meeting and said that India is fully prepared to manage any situation that may arise with regard to the COVID spike. He also issued a word of caution that the COVID hasn't ended yet. India has now issued guidelines to all states to ensure genome sequencing and that it is done on a daily basis. India is doing everything in its capacity to ensure the safety of people in our country. China, on the other hand, has given up and failed its people. It was the one which landed the world in trouble in the first place. Is it time for India to quarantine China and issue a travel ban to and from China? We must learn from our past mistakes and act early, as China is incapable of handling the pandemic as it has been proven. We'll talk about this with people who understand this realm. Joining us on the show is Dr. Suchin Bajaj, Founder Director, Ujala Sickness Group of Hospitals. Also with us is Dr. M.C. Mishra, former Director of AIMS. Dr. P.S.V. Rao, Consultant Surgeon, Manipal Hospital, Hebbal, Bangalore, also joins us on the show. And last but not the least, Dr. Neetu Jain, Senior Consultant, Pulmonary and Critical Care, Sleep Medicine, PSRI Hospital. Thank you everyone for being a part of this conversation. Dr. Mishra, if I can begin with you. Well, sir, it's something we have done before. We have been down this road for 2 years, starting 2020. You know, a couple of months ago, everybody thought that the pandemic is over. But leave it to China to put the world back into harm's way, and that's exactly what has happened. Although the health minister has said that wearing your masks would be a good idea at this point in time. A number of cases are below 200. Our vaccine is extremely efficacious and potent. But at the same time, what more do you think can be done? Tomorrow there could be a variant which can escape the vaccine that we all have. What do we do then? The only, in fact, way of ensuring that that doesn't happen is banning everything coming in from China.
Yeah, that is something which all nations and must think about, whether they would like to allow this to and fro movement from mainland China into their countries, because to begin with, it was the COVID actually came out of China through travel only in 2020. What we saw in Europe and then elsewhere, the whole world was at the standstill. We struggled. We all know the history, how many people lost their life, Delta variant, Alpha variant, Beta variant, and so on and so forth. But what I feel it's happening in China is basically because of their zero COVID policy, which has led to this stage in China, because either their vaccine is not working, as you have said, or they have not been able to vaccinate a lot of people. What we witnessed last December, January, February, March, the Omicron wave in India, which was milder, but it infected a huge number of us, basically, and elsewhere also. And then our vaccination program also went extremely well, including both doses in the beginning and then the booster dose. So put together, we are in a much better position today as compared to China or many other countries where vaccination penetration is not to that extent. So ultimately, we are back to basics, which is mask, distancing, hand hygiene, and any symptoms. Because Vineet, if you know, in Canada, they were terming it as a tridemic. Tridemic, what they called, was COVID. Of course, it never went away, nor it will ever go away. So if we remain in this illusion that COVID will go away, it will not. COVID is a viral infection. It will remain around us forever. Only thing, its quantity and quality would differ as it has following the Delta variant. And tridemic, what they called was COVID, was still there. Then there were respiratory viruses and also the common influenza virus, which hit every country. In winters, we also have the surge of influenza or flu-like symptoms, and it is happening everywhere. So as long as this is not killing a lot of people, this phase will pass away. But we have to be cautious and also start taking those measures which do not allow or which do not require a lot of lockdowns, etc. And we hope that those situations do not we do not witness those situations, because our large number of people got some form of COVID in all the waves, as well as vaccination, as well as booster dose. So I think put together, we are in a better position, but viral infections will keep happening. COVID also is a viral infection, as long as it is not the Delta type variant again causing menace. I think that is what we have to apprehend, and rightly so. The health secretary has brought out this circular to all the states and all the agencies to continue tracking the genomic sequencing of the whatever COVID diagnosed cases are happening, so that we know which variant we are dealing with, and accordingly we can take measures. Naturally, we are prepared, because we never thought that pandemic had gone away. Means pandemic in that form did go away. That it definitely, we all were quite lax. I've been traveling for maybe last 3 months and by air, and we have been conducting courses, conferences. All those things are happening without really surge of infections. But I think we'll now be more careful, and use of mask should be back with each one of us. Thank you.
Absolutely. Dr. Ranga Reddy also joins us on the show at this point in time. Dr. Rao, if you can hear me, sir. Dr. Rao?
Yeah, I can hear you.
Dr. Rao, are we safe, or do we need to do more? We cannot compare our vaccine to China's, but we know one thing for sure. The Chinese don't have a vaccine which is as potent as Covaxin or Covishield, but at the same time, you have to be sure that there are no mutations in the future which could escape the detection of some of these vaccines.
Good afternoon to you and your viewers. There are 3-4 points. Number one, we don't want a repeat of China exporting all these new viruses to us. And for that, we need to ensure travel restrictions. Last time, we were among the earliest to block flights from China, but the virus came through Gulf and Europe. So we need to be careful on that. Second, all of us need to be back with the mask, like Dr. Mishra said. And of course, I have still been using the N95 mask, and even now I keep using the N95 mask. And that will protect us from whatever variant of the COVID, also against the other respiratory syncytial virus and flu virus, which Dr. Mishra referred to as the tridemic, which has been affecting North America, and any airborne infection. So mask is a good idea to keep protect us, vaccine or no vaccine. Thirdly, our vaccine has proved to be effective because compared to the Chinese vaccine, and we need to see when the antibody levels come down, if we need to go ahead with another booster dose or update our vaccine so that it takes care of the newer variants. So more than the vaccine, I would say let us take basic care which is effective for any airborne infection, that is masks, avoiding crowds, and using disinfectants. Now, other than that, why has China failed? Because they initially did a massive lockdown locally, but allowed travel and let the virus spread to the rest of the world. But their vaccination, one, the vaccine was ineffective. Second, their priorities was totally wrong. if you remember, I had written about this last year. Their priority was the first group to get a vaccine was the army. Second group was to the industrial workers. Third group was the medical workers. And then was the people with the comorbidities. And the bottom was the old people. So they inverted the entire sequence. Now, when this new virus has, a new variant has started, is a B27, it has affected the elders. It has affected in schools. The initial clusters were in schools, in old age homes, and all those who were never properly protected. Actually, most of their elders have not even been given a proper 2 doses, forget the booster dose. So this is the end result of this problem. And prolonged lockdowns has protected them from the less deadly variants, and hence has not helped to develop the crowd immunity, what we call as a herd immunity, because people have not been exposed to the less deadly variant. And now when you get a highly deadly variant, you have a population where the vulnerable are not even properly vaccinated, the vaccines are not effective, plus the rest of the population has not even developed herd immunity. So we need to be now very careful, because the virus will keep mutating. If some deadly variety comes, we have to be sure that if we don't get it either directly or indirectly, and meanwhile we take these basic precautions for any airborne infection. Yes, Vineet.
All right, Dr. Neetu Jain. Dr. Neetu Jain, are you there with us?
Yes, I am there with you.
Okay, well, so far the health minister has said that we advise everyone to mask up, but we haven't really enforced some of the recommendations which were enforced in the past as well, because obviously the situation is not as bad as it was, but there has to be a gradual outlook towards making sure that this is not voluntary, this is done as a necessity so that the virus doesn't spread.
So I agree with you completely. So we have to go back to our previous word to prevent the spread of the virus. And we must mask up and make it a necessity to mask up, at least in public spaces. We should also mitigate the aggregation and overcrowding and all those things which we were doing before. We have to again go down to maintaining a social distancing so that this virus doesn't spread and there are no results like we saw in Delta wave, where mortality was high, morbidity was high, there was so much hospital admissions and everybody was so worried about the impact of the virus. We don't know what is virus of concern at this point in time, what sort of variant it is, what is the mortality of this variant, what is the morbidity of this variant. So better is to take public health measure against the variant. And also, as everybody said, that it is very important to have travel restriction, at least from mainland China and at least from the places which have high impact of the virus, so that virus is not spreading through traveling, which has been the primary way of spreading virus to all the world. So for an individual person, it is very important to use a mask and social distancing, and not to aggregate, not to overcrowd, not to fill up the markets, not to fill up the wedding seasons and festival season and all those things. It is the most important public health measure till we are more clear about the impact of new virus or new surge in this country. Till now, we don't have numbers to enforce it in that fashion like we enforced in previous wave. But it may start as voluntary exercise, but involuntary or a necessity of masking up may become very important in future.
Dr. Bajaj? Dr. Bajaj? Are you there with us? Dr. Bajaj, if you can hear me? Okay. Dr. Ranga Reddy? Dr. Ranga Reddy, if you're there with us?
Yes, I am with you.
Right. So do you foresee that there could be a probability of us going back to the highest level of precautionary environment as it prevailed when COVID was at its apex, or do you think that the worst is behind us despite these surging numbers in China?
Good evening, all. I think when we look at the current situation, It is predominantly looks like driven as more of a case, which is coming out from US, IHME, and also the Hong Kong based studies and their predictions. We don't have the hard data actually coming from China in order to say that really there is a problem or not. That is number one. Number two, assuming that really these predictions and also the news which is coming from mostly media, if it is right, then there are probably two scenarios which can develop. Scenario one, if this particular wave or the surge is predominantly driven by Omicron or any other variants which are in circulation up to now, then I don't see a big trouble for India, nor for rest of the world. But if the situation is going to turn like, the predictions have given, that every day you are going to see something like 35 lakh, people getting infected, and probably 1 million people dying in next 4 to 6 months. If that is the case scenario, there is going to be imminent mutations which are going to happen, which probably can drive us into another variant, which we don't know how that particular variant is going to behave. If that is the kind of case scenario, definitely we need to be worried about, because we don't know how that particular variant would behave, what kind of measures would require. Because if you look back historically, between the wave 1, 2, 3, all the kinds of variants have behaved very differently, and our interventions were very, very different. For example, if you look at the Delta wave, we required more of oxygen. It is predominantly driven by the pulmonary complications. But when we look at Omicron, it was less of actually pulmonary, more of other symptoms which did not require any oxygen. The oxygen, which was in shortage in the second wave, and we lost some valuable lives. So we don't know, what is going to be the new variant. If that variant is going to behave entirely differently than the existing variants, our public health interventions are to be accordingly. But having said that, I think, the central government directive which has been given to the states to ramp up the vigil and also the alertness, that is very, very timely. States should seriously take this guideline very seriously and ramp up all the COVID appropriate behavior, testing, tracing, treatment, even vaccination had to be restarted. And genomic sequencing had to be mother of all our interventions, because if we are not going to do the genomic sequencing, probably we may miss a new variant which is going to emerge out of the spike or the spurt which is happening in China. So I think, country is prepared well. As, colleagues have already mentioned, India is in a better situation in terms of its immunity level at the population, due to both natural immunity, which was developed because of 90% of the population getting infected, and adding another layer, that is a very big drive of vaccination which is taken up. I'm sure, we are in a better situation. I don't see, to be overtly worried about what is happening in China or what is reported to be happening in China.
Right, absolutely. Concluding thoughts from everyone. Dr. Mishra, starting with you, sir. Sir, in terms of our vaccines, in your best gumption, are they prepared? Are they ready for any kind of a mutation?
Vineet, the mutations is a continuous process with these viruses. Mutations will happen. Genomic sequencing will bring about those mutations, but which mutation would be more detrimental, that we will know only with passage of time. I hope that whatever we have gone through over last 3 years, close to last 3 years, will come handy for all of us. because we have seen the worst. China did not see the worst. You see, we discussed China, I think, umpteen number of times on your channel with you and Rishabh and everyone, that China we cannot trust for anything. If they are saying more numbers, we cannot trust them. If they are saying less numbers, we cannot trust them. So there is a huge trust deficit with China in terms of what we are getting. All these information we are getting is not official. And official, we will not get. So we should not base too much of our policy based on China data or whatever. We have to see that how best we can continue to do what we have been doing over last 2 years since the vaccination program began, and also genomic sequencing. Now we are in a much better position to do genomic sequencing, which is for both research as well as to guide us that we should not be too much worried about it. And I think that is something what most countries will also do. Like UK also is witnessing huge surge. USA is witnessing, Brazil is witnessing, Japan is witnessing, South Korea is witnessing. So in winter months, these viral infections of all kinds of viruses, including COVID, which is also a virus, RNA virus. So this will happen. COVID will not disappear. We have to learn to live with it, as we have been discussing over last 1 year. That virus, once it comes, it doesn't go away. Only thing, it will come down, it will go up. It will come down, it will go up, like in common influenza. And as long as it remains a common influenza type illness, then it's not a cause of concern. The problem we faced with Delta variant, and that will be our hope and pray, that it doesn't happen again, that kind of a variant which impacted the lower respiratory tract. As long as the virus impacts the upper respiratory tract, we are not worried, because that is something which happens. Pre-COVID also it was happening, post-COVID also it will happen. So, and with COVID also it will happen. So I think, and we are now better prepared all across the country. So I think we should look after our house, irrespective of what China is reporting or not reporting.
Let me also rope in Dr. Bajaj, if you can hear me. Dr. Bajaj? Dr. Bajaj, if you're there with us?
Yes, I am. Can you hear me?
All right, Dr. Rao?
I think.
I'm here. Can you hear me?
Yes, Dr. Bajaj, I can hear you. Go ahead. I can't see you, but I can hear you, sir.
So, Vineet, I think we need to keep this in mind that those who fail to learn from history are doomed to repeat it. History as such doesn't repeat itself. We fail to learn from it, and then we keep going through the same things again and again. We should remember that it was 3 years ago during Christmas when Wuhan had the first surge, and then people traveling from Wuhan to various countries brought the virus with them. And now we are seeing the same thing. And as in the first phase, I think the world agencies are failing to recognize what is happening. It is very clear that China's vaccine has failed, but they are too proud and I think too obstinate to ask for help from other countries. The Middle East also understood very quickly that Sinovac had failed, and they, I think, started doing it all over again with Pfizer. Everyone was revaccinated. But China is not taking that step and not asking for help also. And this can lead to a lot of issues for the rest of the world if, due to this massive spread again, we get new variants that we cannot control. Then I think the whole world is going to have a problem. So it is time for the world agencies and the larger countries to step in very quickly and convince the Chinese leadership to ask for help in this condition and make sure that we run a new, completely original vaccination program all over again in the entire country.
All right, Dr. Rao, concluding thoughts from you, sir.
Being concerned is important, not worried. Worrying will lead to policy paralysis. So we need to be concerned. What is our concern? That the new variants or new mutations from China can spread to us. So like we discussed before, we need to take travel restrictions. We need to take masking and avoiding crowds, which is effective against all airborne infections, including flu, etc. And we need to ask our vaccine manufacturers if they can update. For that, they need to know what is the new variant. That is where the genome coding is important. This is why the Indian government has said, please send the latest infection cases samples for genome sequencing. So this is the way we can help ourselves, because like everyone is saying, we can neither trust the Chinese nor expect any help from them, and they are not going to take help. So we are stuck in a situation where the whole story may repeat itself, and we need to be concerned, and these are the measures we can take. Over to Vineet.
Absolutely right, sir. Dr. Reddy, concluding thoughts from you, sir. This is a good point that worry might perhaps deplete and not resonate well with the citizens. It might deplete our gumption as well as our prudence when it comes to dealing with this virus.
I fully concur with Dr. Rao. I think we should not be kind of worried. Rather, we should be concerned, and we should be prepared well for the kind of eventual development which may happen with the newer variants. As the speakers have talked before me, I think India is prepared well for any eventuality. Our infrastructure is geared up. Our healthcare professionals are very well trained because of the first three waves. Our population, has got, a meaningful kind of idea on how to avoid, kind of infection or the contracting the infection. So keeping all those in mind, I don't see really a big worry for India. Rather, I think, our energies should be focused on what actions and what interventions we had to do at the government level, at a private level, at an individual citizen level. I think that is what is going to make us actually overcome
You're absolutely right, sir. You're absolutely right. It's a collective effort. It is not only the government's responsibility and prerogative, it is our concern as well, and each individual can contribute towards making sure that we don't go back to that phase where COVID was at its peak.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.